Hello, I'm Michael Pierce, and this is The Human Condition. Our topic today is how to prevent hard labors and delivery. This is a topic near and dear to me because I've been involved in it since my childhood. My own family was involved in this, and my own mother was doing fantastic work with La Leche League and home birth processes and helping women understand in a lay environment without doctors and nurses how to do this kind of stuff. And that's not to insult doctors and nurses, it's just to say that you should take your power back around labor and delivery. So I'm a chiropractic neurologist and a QEEG guy that does brain scans, but I want to now defer to my fellows in chiropractic that are chiropractic pediatricians. Chiropractic has some specialties like radiology, pediatrics, neurology, we have orthopedics, we have a bunch of other specialties in chiropractic, and so I want to defer to my fellows in the pediatric subspecialty. They do a very good job at adjusting infants and babies and newborns. They do a great job at adjusting pregnant mothers and expectant mothers, and even helping people preconception to get ready to conceive and be fertile. Because, you know, fertility is not under the control exclusively of the medical profession and science. It's also under the control of lay people and basic knowledge of health and wellness. The first thing to prevent hard labors and deliveries is to make sure that you have good food and nutrition and diet. It turns out that the best predictor in all the textbooks of public health for difficult labor and delivery has to do with the prenatal care. And that means, did somebody monitor that lady as she gestated her child through the 9 months process? Did she get good diet? Did she get good regulation? Did somebody check her? Did somebody look at her skin and her digestion and meet with her and make sure that she was eating right and pooping right and sleeping right and doing all those wonderful things? It's someone that knows how to do this. And those are midwives and doulas and birth coaches and La Leche League leaders and chiropractors and acupuncturists. And I've got to tell you that that environment really does help prevent most difficulties. There are a number of people enter conception and they're toxic, or they have some genetic problems, or they have other difficulties that they're not ready to conceive, and yet they conceive, and then they have miscarriages, unfortunately. And so I don't want to make this a value judgment for people about miscarriages. I want to tell you, if you're pregnant and then you suspect, oh my goodness, I didn't know about detoxification, or I've discovered that I've got some toxin, don't detox during pregnancy and during breastfeeding. That's not a time to detox as a mother. If you missed it and you need to detox, or you perceive the need to detox, save it for after you've delivered the baby and after you've nursed the baby. You really don't want to undergo an aggressive detox while you're nursing or while you're gestating a child before labor and delivery. So wait till you're done nursing and you're done saving milk if you're saving milk. The problem is that you're going to detoxify too rapidly and you're going to hurt yourself. So let your body's wisdom retain those toxins if you enter pregnancy unexpectedly and you feel like, oh man, I've got heavy metals or pesticides. Do the best you can to eat healthy while you're pregnant and while you're nursing, and your body has some wisdom to be able to take care of that. Now, if we need to help the baby, there's ways that we can do that. The most important, I think, is to make sure that the baby gets breastfed from you. Even if you're toxic, your breast milk is much healthier unless you're acutely toxic by some massive poisoning. If you've got these chronic toxicities, your breast milk will still be safer for the baby. If you have marginal breast milk and you're not sure that it's okay, you may have a surrogate, a milk provider. You may find another wet nurse that can provide milk from her breast for your child, and that may be very useful and very helpful. I'm not against that, and I think that's better than formula. Yes, I said that's better than formula. Make sure you have good sleep. It's extremely important to have good sleep because sleep is the most important healer in the body. Good sleep will help you with being able to have better labor and delivery and being able to prepare for that process. And making sure that you can see a chiropractor that understands the Webster technique, which is one of several really interesting techniques. The techniques in chiropractic, they're like surgical techniques, and they have proper names. There are several techniques in chiropractic, over 200, and I don't denigrate really any of them, but especially the ones that I've seen work really well for women that are thinking about this process and looking at labor and delivery that are very gentle are things like the activator method, where they use a little clicker, a gun that is not a gun, it's just a little tiny pusher, and it pushes on the bones with a soft rubber tip. It's very, very gentle. You can use it to adjust babies, you can use it to adjust people with weak arteries and arthritis in their neck, and it doesn't hurt them. It's super gentle. I mean, you could fire it on your eyeball and it doesn't hurt. It's that gentle. The Logan Basic technique is where the doctor presses on ligaments in your pelvis to move your sacral bone. There's the sacro-occipital technique, which is where the doctor puts blocks under your pelvis, and those blocks, they act as fulcrums and they use gravity to help reset your pelvis. It's very gentle. There are Thompson devices, which is a Thompson technique. It's a special chiropractic table you may have seen where the patient lays on the table and the doctor lifts up a section of the table and it cocks kind of like a little gun. It goes click, and then the doctor dials in the weight of the patient, and then the patient falls with the doctor's pressure by like a quarter inch or a half of an inch. And they're on very thickly padded pads. When you're pregnant, you lay on a special big support, a big piece of foam that protects the baby, so you can lay face down, you can lay face up, and the doctor can still do these techniques. So the doctor presses gently on your spine, your pelvis, your shoulders, your neck, and does things where the table does this tiny little drop, and he uses inertia to allow the bones to move with such little force. It feels so gentle and so easy. That's called the Thompson or Thompson-Deerfield method. You may also enjoy, very strong methods like a seated Gonstead method or a knee-chest method where you're in the Gonstead knee-chest position, where you're on your hands and knees and the doctor adjusts your low back. This can be beautiful for adjusting the low back pains of a pregnant woman. Be aware that there's a lot of chiropractic methods that work, and there's many more that I didn't name, but these are some of the important ones. You also may notice that pregnant women can have, just like anybody, problems with upper cervical specific misalignments, where their atlas vertebra is out of place and their head is out of place, and they just can't get it corrected with standard chiropractic adjustments that are kind of generic. And that's not to denigrate those adjustments, but there are techniques where a patient may get a supine, laying on their back, adjustment where the doctor adjusts their neck in kind of a manual way with their hands very grossly, and doesn't hurt the patient, and it doesn't injure them. It just sometimes doesn't fix them because they've got a very specific misalignment that requires a specific aim of a device. And these devices are sometimes an instrument or a stylus that will be put gently on atlas, and it gives a little bump, and the bump is so gentle, again, that you could take it on your eyeball. It's so gentle that it's not going to hurt you, but because it's aimed in 3 dimensions in a specific way based on the x-ray of the neck, it can realign the neck very beautifully. Now, if you're afraid of x-rays, the baby can be shielded with a lead apron so that the baby doesn't get any x-rays while the mother has gotten the x-ray of the neck. You can get that x-ray to see if your neck is misaligned in a very difficult way, and sometimes with those difficult misalignments, the doctor can find them with a special x-ray machine that's plumbed to the earth, that's plumbed in 3 dimensions. Most x-ray machines aren't plumbed, and the patient is shot on their x-rays laying down on a table. And that's a good thing, because in the medical profession, you want the patient to be as thin as possible so the least amount of x-rays go through them, because you're looking for broken bones. But in chiropractic, we're looking for misalignment, so we have to shoot them upright, which means the x-ray machine has to be plumbed or aligned in 3 dimensions with a frame. And so these special upper cervical techniques like NUCA and Atlas orthogonal and Blair and Palmer upper cervical, these methods that require special x-rays have to be shot upright to preserve the natural position that person stands or sits in, so we can capture their misalignment and their unique problem. And we can see if it's one of those difficult ones to fix, and then we can set a vector of how we're going to fix it with either an instrument or with our hands and arms, which is done in chiropractic with very gentle methods, super gentle methods. So just realize that that's ways that we can help prevent hard labor and delivery, and don't forget to use your acupuncturist, your midwife, your doula, your birth coach, your La Leche League leader, and tell me what you think of this video.